This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
They say that our collective set of memories make us who we are. But what happens if our memory is gone? Memory loss is commonly associated with aging. One condition that greatly affects the memory is dementia. Dementia is a syndrome, usually of a chronic or progressive nature, caused by a variety of brain illnesses that greatly affect memory, thinking, behavior, and ability to perform everyday activities.
There are some goes with the process of brain loss, brain cell loss. Just because of constant falling of good brain cells, they begin to lose their memory. You just forget things, you just forget about the environment, you don't seem to care what's going on.
Patients suffering from dementia are usually difficult to handle. That is why they need special attention.
For the people who have dementia, there's nothing we can tell them except to be patient with them and try to understand that the patient you're dealing with does not even know what's going on.
According to the World Health Organization, the number of people living with dementia worldwide is currently estimated at 35.6 million. This number is expected to double by 2030. And as the number increases, awareness should also increase as we continue to care for people with this disease. What are the signs and symptoms of dementia? How can we raise awareness about dementia? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Lourdes Ledesma, neuropsychologist from the Makati Medical Center. Also joining us is Dr. Renato de los Santos, Medical Director, Geriatric Psychiatric Hospital Program in Election Brothers Hospital, Hoffman Estates, Chicago, Illinois. Hi doctors, welcome to the show. Welcome to the country.
Thank you very much. Yeah.
Tonight we'll be talking about dementia. We'll get to understand it more and we'll get to have a clearer perspective on how to take care of our family members or those we know who are suffering from dementia. First, let's get to understand dementia. What exactly is it?
Dementia is a really medical diagnosis that pertains to a disease in the brain. And it is characterized by significant memory problem. And as it progresses, it may cause impairment in language, as well as motor movements. You can see the difference that there is a decline from the patient's or individual's prior level of functioning. So you can see the decline. Mm-hmm. And sad to say that if you're dealing with the typical types of dementias, it is a neurological condition that will take a progressively declining course.
What part of the brain, since we're talking about the brain in relation to dementia, what part of the brain does not function as well?
There are different parts. Mm-hmm. It depends on the type of dementia that you have. There are some that affect the frontal and temporal side of the brain. There are some that affect all the brain slowly, gradually, the cortex, the gray matter of the brain. And then there are some like vascular dementias, for example. They're caused by mini strokes, many little strokes that accumulate over time. It depends on where the stroke happened. So it's not one part of the brain makes you demented.
Okay.
But interestingly, because there's just still a lot of things we need to know about the brain, we know that there is a section of the brain called the hippocampal area.
Yes.
That is in charge of memory, and when you ablate that section of the brain, you will not be able to remember things, and you will have no ability to recall. The function of memory is very interesting, because it could be just me remembering you when I fly back to Chicago.
Yes.
And if my hippocampal area is working, then I will be able to recall and remember what you look like.
Okay.
Now, hopefully in my trip back to Chicago, my hippocampal area is going to be intact.
Okay. So you can remember me and remember the show.
There will be no memory.
Yes, yes.
So it's very interesting, because when you talk about a certain section, like Dr. Ledesma was saying, you know, what part of the brain, where does it start?
Yes.
You know, the brain is like a circuitry or circus of connections and interconnections, and billions of cells in the brain. And it has taken us so many years to really understand what is going on. It really wasn't until about, I should say, in the 70s that we started to have the ability to do the neuroimaging studies, that we were able to identify specific parts of the brain, specific functions of the brain that correlates with the different signs and symptoms of different neurological conditions. So a lot to be discovered.
So
in the early stages, kasi it will vary, even the way the complaints, in the very early stages, some will say that they're becoming forgetful. Others, they will report changes in personality. You know, it can manifest that way. But as the disease progresses from the mild stage to the moderate to the severe, they eventually all present the same way. Regardless of what type of dementia it is.
You mentioned there are different types of dementia. I think the more common, or the most common, is Alzheimer's. And
You're right.
I think, if it's associated with dementia, I think they're just one and the same. But they're not.
Well, you know, it's very interesting that you say that, because I think that a lot of people will say, you know what, I only have Alzheimer's, but I don't have dementia. Or somebody would say, I have dementia, but not Alzheimer's. I don't have Alzheimer's. So dementia really is the heading for so many types of. So, and the most common type, and I should say that most literature will tell you about 70% of the cases of dementia is of the Alzheimer's type.
Okay.
And so Dr. Ledesma pointed out the second most common type, which is the vascular type, secondary to strokes. And you know, one of the very amazing type of dementia that you could never miss when you do a CAT scan of your brain is when you have the Pick's disease, was otherwise known as a frontal lobe dementia, because the frontal lobe actually shrinks. And when you do a scan, you will not see anything. The frontal lobe actually shrunk. So it's gone, you know. So it's.
And the feature of that type of dementia is more psychiatric, more behavioral than the memory loss, which you would probably see in other types. So there are many different features.
So Alzheimer's is a type.
Is a type of dementia.
That's right.
Yeah, and you have the vascular, you have the frontal lobe or Pick's disease, frontotemporal lobe.
Also.
Yeah.
It's not only that you had Alzheimer's, but you have vascular also combined.
Well,
you know, there's you can have features of both.
Dr. Ledesma pointed out, you know, all the dementias, because of the different parts of the brain that's being affected, can affect the other parts of the brain. Like in Alzheimer's, dementia is very specific in the hippocampal area. But all the projections into the frontal lobe can be severed and disconnected. And so that starts off with, you know, as you said, it may not be the memory that may be significantly impaired at the onset. It could be a lot of frontal lobe personality changes, and then associated psychiatric symptoms, which to me is in the field of psychiatry, and I'll have to mention this very briefly, because there seems to be a dichotomy in the medical field of what psychiatry is and where it is in the specialty of medicine. They don't seem to appreciate that the mind is so much part of your body.
Yes.
And so the dichotomy of the mind and the body has been an impression, and still in practice, that's why there's a lot of stigma when they say, go see a psychiatrist,
yes.
or if you have a psychiatric condition,
Yes.
because they refer the specialty as the mind, and where is the mind? The mind is in the brain. And so why would that be such a stigma? Why would that, you know, there's no problem if you have a heart problem,
Yes.
or a gastrointestinal problem, or any other organ problem. But why is it that the brain seems to be quite a stigma? And I think, Dr. Ledesma, it has to do with the reference to conditions that are called insanity. You know, so, oh, you're crazy, you've got
Yes.
to, you know, or because most of the symptoms in the course of these conditions will manifest a lot of psychiatric symptoms.
And these psychiatric symptoms are not the norm. So when people hear of it or notice it, you immediately send them or recommend that they go for psychiatric help, which sometimes they don't really need.
Right. Well, you know,
Not necessarily psychiatric.
Yes.
right. Well, and then when you say forgetfulness, it does not necessarily mean that you have dementia, because there is such a thing as normal forgetfulness of aging.
Okay.
And that's
yes.
perfectly fine. I mean, that's to be expected, right?
Thank you for that.
I know, but that's,
So relieved.
but that is true. And then there is such a thing as mild cognitive impairment.
Okay, what is
And
this?
that is not dementia as well. I mean, it is more than just the forgetfulness of aging. A lot of interesting theories about mild cognitive impairment is that some people think that it is a precursor to possibly an early stage of the dementia. So should you do something? Should you not do something with mild cognitive impairment? In fact, one of the most fascinating advances in neuroimaging is the ability to do a PET scan, which is the positron emission tomography, where they actually use a radioactive tracer. In Alzheimer's dementia, for example, the pathology in the brain is the abnormal deposit of amyloid.
What is amyloid?
Amyloid is a lipoprotein that is found in between cells that will kill the cells. And then inside the cells are what we call neurofibrillary tangles. And so what causes that? And so very early on, even before the manifest symptoms of memory impairment and other dementia symptoms, you may have all of this deposited in your brain and nobody knows. So the question is, and the fascination about the advances in neuroscience is that you can finally find the tracing of this long before the symptom can be manifest.
And in finding and tracing all these symptoms before it can manifest, who are more prone? Are there individuals more prone to dementia, Alzheimer's? Or are there individuals who just have it and then it just develops in time without any gene passed on to them of the disease?
Yes, there are some where it's in the family. You know, when you interview them, they'll say, oh, you know, there's this member and usually those with early onset that manifest it when they're in their 30s.
So as early as in their 30s?
Yes, those are usually the ones where there's a genetic reason for they're presenting that way. And then there are others where you don't know.
I think that
it just one day it just happens and then
it's slow.
Slow progression.
Your typical type of dementia is like Alzheimer's has a very insidious onset. You know, it's very discreet, very subtle, and then it takes on a progressively declining course. Usually with those associated with strokes, usually happens abruptly. But the question that you ask is really who are at risk for the dementias. And Dr. Ledesma pointed out genetic predisposition. Also anything that will cause insult to the brain.
Anything that will cause insult to the brain.
Such as
Traumatic
brain injury.
Yeah.
Because it's a decline from a previous level. So if you were able to do this before, then you
all of a
can't
sudden you're not
anymore.
anymore
Yeah,
able to
and
do
it's
it.
not because you've aged, you know, it's more than that.
Okay.
So
doctors
that
will,
would constitute dementia.
We'll talk more about dementia,
Yeah.
Alzheimer's, or prone, what we can do about it, and how to catch it early on when MedTalk returns.
Did you know that dementia can have an early onset? Doreen Watson-Beard is one of the tiny percentage of people in America experiencing early onset dementia. Diagnosed at the age of 44, she would exhibit forgetfulness. She would forget to pick up her grandchildren and would write the wrong dosage for her patients, which she does regularly. Watson-Beard is a longtime nurse who has cared for people with dementia and is now leading a support group for them, including herself, and is now out of the workforce because of persisting signs and symptoms.
We're back here on MedTalk, still talking about dementia. Before the gap, we were talking about causes or who are at risk, as you
Correct.
mentioned earlier. So let's go back to that a little bit. Who are at risk of getting this disease? Because we have established that dementia is a disease.
Yes, it is. Genetic predisposition. Clustering in the families, we know that an individual who does not have a relative who has Alzheimer's dementia are less at risk compared to those who have relatives who have Alzheimer's dementia or any kind of dementia for that matter. Infections of the brain, any insult, any trauma, traumatic brain injury, post-vehicular accidents, closed head injuries.
Also certain medical conditions, like if you're hypertensive, you're more prone to stroke. And if you don't take care of that, you could have mini strokes, you know, and then you would have vascular dementia. And that's something that's preventable, diba? Because you know na you're hypertensive, so you want to make lifestyle changes.
Yes.
Same with diabetes. If you don't control it, it could have an impact on your brain and your
Not to forget to mention about alcoholism.
Alcoholism.
Dementia secondary to chronic alcohol use. That's very important to know. Because when you're drinking and having fun, you never think about dementia.
No.
Right?
No.
So the
Never.
mantra is,
Because there's fun there.
Yeah.
There's fun
Right.
involved. So why will
Yeah.
you think of something like that when you're
Yeah,
having
but
so
it's a
much fun?
chronic alcohol problem. It becomes problematic. In fact, the brain is not the only or body organ that's going to be affected.
by it.
You know, the heart, the liver, everything else.
Your entire system.
So your
Right.
mantra is really healthy living.
Okay.
That's, you know.
Yeah.
And our mantra here on the show when we have our Facebook question is to share it with you, doctor, so you can help our Facebook friends and our Twitter
Yes.
friends. So a Facebook question is dementia fatal? Fatal.
Well, you know, if I have to be romantic, I would have to say it is emotionally fatal.
Yes.
Okay.
Very
The
sad.
disease itself. Think of somebody who's alive and who's lost their memory. Think of somebody that you know and has who is alive and has personality change.
When your cognitive abilities decline, it's hard for you not to make good decisions.
Well,
Doctors, we'll
right.
go back to that in a while. We have a question from Twitter. If a family member is diagnosed with dementia, how should we deal with it? We mentioned the movie The Notebook. That is a family member, you know, your
Right.
spouse So how should one deal with it?
Dr. Ledesma, if you don't mind, I will take the first response to this, because I think this is an opportunity to share with everybody that there are dementias that can be treated. But I think I would group dementia into reversible dementias and irreversible dementias, because Alzheimer's dementia, for example, which is the most common type, is not reversible. It will progressively decline. Vascular dementia will decline. The frontotemporal lobe will decline. But there are dementias that are caused by medical conditions that will actually be reversed if you treat the underlying medical condition, such as hypothyroidism, such as vitamin B12 deficiency. So how do we prevent, I think, or how do we deal with somebody who's got dementia is to answer the question, what kind of dementia? Okay. Because, a consultation with a medical doctor to have an accurate diagnosis will guide you to the best treatment of the dementia.
That's right.
I wanted to emphasize that, because we don't, when I say it's a very fatalistic kind of disease, it's fatal. I don't want to take away the sense of hope, because I don't want people to be scared to come to see a physician. There are reversible dementias, and the detection of the irreversible dementia, then we can also talk about the treatment for that as well. So consult your physician. And the physician will guide you to do the necessary testing, and Dr. Ledesma specializes in neuropsychological testing. That's if any doctors out there, because really it's not just the public that are not so familiar about the dementias, but the other doctors need to be educated about what can be done with this.
I think one of the things we want to put forth also is oftentimes we say, she's getting forgetful because it's old age.
Yes.
And what we want to put forth is, if you're suspecting that there's a decline, her memory is going, she's not as sharp, bring her to the doctor instead of just accepting it as part of the aging process, because for all you know, something can be done, and there are more treatment options now than before.
So in giving the treatment options, we have a question here from Facebook. Are there institutions that provide care for people with dementia? Is it advisable to let them stay there? Like in our culture, we always want our family members close to us for us to monitor them. But when it's out of hand, would you say, or when?
I think that is a psychological question, a very psychologically enriched question, because it brings up a lot of psychological issues, such as if I bring my mother to a nursing home, for example, or an assisted living program. In Chicago, we've got so many forms of residential homes. We have supportive living, we have assisted living, dementia-specific programs, we have nursing homes. I think it's the question of, am I abandoning? Am I giving up?
Yes.
The emotional consequence of, guilt. But as a physician, I have to say that as the disease progresses and it starts to disrupt, and actually, imagine somebody who can be violent. Imagine somebody who could be wandering out and getting lost.
Yes.
Somebody who could just turn the oven on and forget to turn it off, burn the house, or start a car and drive when they don't know where they're going. So safety becomes an issue. And so that's why you've got a lot of programs there that are very dementia specific to provide secure, a safe environment, both for the individual and other people. And so if that is in fact an option, it is an option. I would like to educate the families and I think Dr. Ledesma, I think we can partner with them in going through the psychological,
the process.
and
come to the realization that it is for the best.
Right.
These are those already diagnosed.
Yes.
As they are progressing.
They are progressing.
Yeah.
But I think that for as long as the patient can be safe at home and the people around them can be safe and they can be managed, I would always support the dignity of living at home.
At home.
But when it's no longer safe for them, the patient, and the family.
And maybe there's harm already.
Yes.
That's
Yes.
done. Sometimes you mentioned that the patient can be violent.
Yes.
So
Yes.
that can be a deterrent to making that individual stay at home.
Right.
Yes.
So
Yeah.
it's advisable, and it doesn't mean that you're abandoning them. You just want to give them the best care, better care.
Better
Absolutely.
care. Better care.
Yeah.
Than what you can provide. So it's a case-to-case basis. But it shouldn't be looked upon as abandonment.
Okay.
Not necessarily.
That's good to know. Yes. How about medications? Let's say it hasn't really progressed yet. You catch it early on, and are there medications that can be given to the patient?
Very early stage dementia, there is a group of medication called Acetylcholinesterase Inhibitors. I
What
think
does this do?
these are like, well, the neurochemical theory in Alzheimer's dementia is that the part of the brain that is secreting the neurotransmitter called acetylcholine is dying.
Okay.
And so we would like to save as much acetylcholine in the brain. So this acetylcholinesterase inhibitors medications will inhibit the enzymes that break down those neurochemicals. And so that's one. But the other thing that I missed to mention, which is extremely important, there is such a thing as pseudo-dementia. And that is really otherwise known as depression in the elderly. And so
Sundowning, I hear that a lot.
that's another symptom of the dementia itself. But depression in the elderly can be treated when you treat the depression.
Okay.
So that's you can use an antidepressant medication. And in
It
mid-stage,
looks like dementia, but
Yeah.
it's not.
It's not.
correct. So and in mid-stage dementia, you have another medication called Namenda that's available. But because there are so many associated psychiatric symptoms with dementia, that's when I think, Dr. Ledesma, you will have your patients that are taking anti-anxiety medications, antidepressant medications. We have mood stabilizers, antipsychotic medications for
And these
hallucinations.
address dementia
Symptoms,
Symptoms.
associated symptoms. These are the symptoms that will emerge in the course of the disease that are very psychiatric in presentation. And that's why they are referred to psychiatrists who are prescribing the medications. Yeah.
The
Yes,
management
Doctor,
kasi
last
of
note.
dementia is a multidisciplinary management. It's not like we all share our perspective based on our specialty. So the neurologist is important, the psychiatrist is important, the neuropsychologist, the allied professions like occupational therapists, rehab people, they're all very important in the care.
And you mentioned care. On the last note, it's also very important that the family members take extra care or better care of their loved ones
And
who
we
have been
also
diagnosed.
we
with
also
dementia.
have to care for the family members.
Okay, so it's team effort.
It's team effort, yeah.
It's
because
a
they're
work
going
in progress.
Yeah.
That's
So that
always-
dementia does not progress. Dementia
wow.
Well, we hope that it
We
will
hope
not, but
that
it really takes a progressively
it will.
declining course. And so, and actually towards the end, it's really an ethical question as to the quality of life. Because, there is hospice, comfort care, and palliative care. So I mean, it actually is just the permission to just let it go. And that is an ethical question. Who has the right to take away life?
Just care for it and then address it and hopefully it doesn't progress, and
Because-
hopefully you can address it well. I'm sorry we don't have enough time
Right.
to talk more about it, but thank you very much for enlightening us and helping us understand more about it, helping us deal with it. As you mentioned, Doctor, it's an emotional death.
Yes.
Yes.
And
right.
that our emotions really take over our entire being, and this topic is really very important, especially to those who we notice have the signs and symptoms of early dementia. So thank you very much.
Well, thank you very much.
Thank you.
Great
Again, we'd
opportunity.
like to thank Dr. Lourdes Ledesma and Dr. Renato de los Santos for joining us in our discussion. See you again next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.